Okay, everyone can see the screens.
Yes.
Okay, Thank you, Dr. Robert introduced me, and thank you everybody spend 1 hour for these lectures in webinar. Okay, so I introduce myself first because this is the second time full English lectures, and because English is not my mother language, so I do my best to introduce this disease to everyone if you have an interested in this disease. I think this disease is very difficult to cure in our clinical jobs. So I have some methods or treatment to cure the babesiosis, and after my master thesis is about these topics. Okay, and I introduce myself first, and I graduated from National Taiwan University in 1997, and I got my master's degree in National Zhongxin University in 2017. And right now, I have a clinic in Taipei City, and I am a president of Taiwanese Society of Feline Medicine, and also Taiwan College of Laboratory Animal Medicine. So right now, I'm a two president right now, and I'm an honorary president of Taiwan Academy of Veterinary Internal Medicine, and also have a teaching work in HR University. And I write some books in Chinese, so just for the Taiwanese and China, the editions. Okay, so I read the food therapy in small animal cats. This is my specialist. So I write the canine and feline cardiology. Okay, and this is my master degrees. So for the thesis, so we just the topic is the therapeutic effect of clindamycin doxycycline metronidazole with and without dimethamine on canine babesiosis infections. My advice professor is Dr. Tong. Okay, so we go to the these lectures. I introduce the Babesia first. The Babesia is the intra erythrocytic protozoals parasite of the phylum Apicoplexid, and this one is similar with the malaria. So we try to treat the Babesia, just follow the malaria's methods. So we always figure out the medicines just treat from the malaria treatments. So we just use the atovaquins, erythromycins. So that drugs just treat the malaria. So this is very similar. And this Babesia have a special organelles. We call that is apicoplast. It's just similar like plastic of the bacteria. So they have endosymbiosis and with the Babesias. They these organelles just provide the nutritions and any protection material for the Babesia when the Babesia invades to the red blood cells of the host. So the Babesia just evolved from the next picture. Because the Babesia is involved from the plant cells. So the apicoplast is similar with the chloroplast. So they will have provide the nutritions and the any amino acids, proteins, and lipid acid for give the Babesia. So can that Babesia can separate and just reproductions and just invest the host red blood cells. So this is involved from the plant cells, and the Babesia just transmitted by the ticks and to the host cell host. The protozoal will pass transovarials. That means it will transmit to the tick's egg. So the whole tick's life cycle, they can transmit Babesia. So even though the larvae, nymph, and adults, so they will include the Babesiosis. So sometimes your dogs just biting or eating the Babesiosis. If the dog's oral member have a trauma, maybe will infect to the dogs. So not only sucking blood by the tick, sometimes your dogs by the ticks maybe will transmit by ovary or by the egg. So whole life cycles of the Babesia have a 3 stage. It's very important. The first one is gonogones, sporogones, and the merogones. So in the dogs, we always call that it is intermediate host, not the final host. The tick is the final host of the Babesias. And I will explain and then at the next slide. And the other one, the tick and the attachment processes will feed in stimulated and reactivation, replication, and migration of patient, the pathogen from the saliva. Because the next slide will introduce whole the life cycle of the Babesias. So because when you suck in the blood from the dogs and will stimulate the saliva to release the sporozoids from of the Babesia to the saliva. So just inject into the dog's body. And the other was the process dynamic of the any pathogens relationship. We are not full understands. So maybe we will introduce in the next 2 slides and then explain how many times and every pathogen need to go into the dog's body. And this one we just explain how to the life cycle. How is the life cycle of the Babesia? The first one we can see here. This is a saliva gland of the ticks. So when the tick saliva just sucking blood, they will spit the saliva into the body, because it's just like a concrete to heal the wound, and the paralyzes the feeding of the skin. So they will inject the saliva inside. So at that time, they will reactive the sporozoid from the saliva glands just inside here to the capillary insides, and just infect the red blood cells. So go into the red blood cell, they will become the merozoid, and the merozoid will trans to the trophozoid ring forms and the ameloboid form, and the other will have a fusion. So we become the binary fusions, and and then change to the pyrophones and the curiciphones. And after that, just rupture the red blood cells, become the infective myeloid. And right now, and sucking by the tick will go back to the if the tick without the babesiosis, they suck have an infection dose, the myeloid phone will go into the intestine. Go inside intestine will become the sexual reproduction phone. So how we call the tick is the final host, because they have a sexual reproductions. So in this area, they will become the macros gonad and the micro gonad, and they will become the fusion of the gonads. It will become zygote. So the zygote will go into the intestine cells and just go inside the lymphatic system. So one way will go to the ovary to infect ovary. The other way will go back to the saliva gland and then become the sporoblast, and they will hiding here. So only one way the Babesia will hiding just in the final host is tick. So in the dog's body, they were immoral, so they were not hiding in any organs. So that's a paper didn't say they will have like the plasmodium, malaria forms. They were hiding in the body because the malaria have hypozozoid in the liver cells. So they were hiding in the body. So if we use lots of a drug could not cure malaria easily because they were hiding in the liver cell. But in Babesia, only in the tick, they have a hiding phone here. But others in the dog's body only life cycle in the red blood cells. So I didn't think you will hint in the maybe spleen cells, the cell of the spleen or some lymphatics areas, organ or tissues. Okay, so this one we just explained during the blood meals, the ticks will transmit the pathogens. The times they will from the small particle to the big particles. So the small one, the smallest one is a virus. So in few minutes, when the tick was sucking blood, they will transmit the virus first. So virus is a very terrible one. Is the tick-borne encephalitis virus. This one is very terrible virus because when bite will get the encephalitis and cause the neurologic symptoms and cause the dog's death. But it's very lucky in Taiwan we didn't have this virus. So this disease we didn't find any case in Taiwan. And then after 3 hours, they will transmit the Ehrlichia canis. So this is so why we use with the oral protection drugs, we cannot protect Ehrlichia from the use such as spectral or brevicals. And after 5 to 20 hours, they will transmit the Ehrlichia. And 24 or 48 hours, they will transmit the Anaplasmas. So Lyme disease will, after the 66 and 72 hours, they will Lyme disease. So our babesiosis will transmit after the 48 hours. So right now, if we use Brevik vector or NASCAR S, we can prevent the babesiosis because we can kill the ticks in 12 hours. So we could not we can very successful to prevent this disease. Okay, so many invasive stage real on the active form of the movement, because when the this slide we want to explain how to the Babesia how to go into the red blood cell. You just use the some organelles functions, just like the mammary animals actual myosin systems. So we coding the glidosomes, so they can use these organelles secrete and like receptor bindings, and that the Babesia easily to go into the red blood cells. So we call that is gliding motility. So that will this involves organelle. We have the three ones is micronates and the ruptures and the spherical body in Babesia. So we use the plasmodians form. This is the malarias. So we in Babesia we call dancing granule is a spherical body. So Babesia we call this one is just a spherical body. So other things are the same. So when the Babesia go inside, rupture necks and the micronails will secrete some proteins and the amino acids just inside, and the user receptor to connect here, and they just let the Babesia easy to go inside. And the establish of the parasital porous vacuums. They will secrete the amino acids, protein, and the lipid acid. So just cause a membrane to protect the Babesia or plasmodians go into the red blood cells. So this one is how to go through in the red blood cells. And the other things we want to introduce the Babesia and the Ehrlichia, how to let the dogs will have two problems. It's as autoimmune hemolysis anemias. So because when the ticks it just bite the dogs, they will saliva, they will spit the saliva. The saliva will have some protein will inhibit the dog's cellular immunity. So they will let the Th1 cell lymphocyte become no functions. So the dogs only go to the humoral immunity. So they will go to the Th2 and transmit the cytokine to the B cell. The B cell will produce lots of antibody, and this antibody will binding with Babesia or Ehrlichia. So they will cause what? They will cause the immune complex. When the immune complex will just accumulate in the joint, will cause the arthritis. In the uvea will cause the uveitis. In the kidney will become the glomerulitis, and in the skin will got the itching and the patch on the skin. In the neural system, it will cause some like seizure problems. So this is a side effect here. And the other one will have a cross reaction antibody, then they will attack the organ. So sometimes why have a hyperglycemia will have lots of problem, immune problems here. So if here we just too early to give the blood transfusions, the antibody will attack the red blood cells, so will cause the autoimmune, the immediate and the hemolysis anemias. So autoimmune problems is here problems. So it's got a lot of auto antibodies. So they will attack the red blood cell and the platelets. So sometimes we can see dog have a thrombocytopenia. It's because the auto antibody will attack the platelet, but some dog without. So they can explain why the dogs infect the babesiosis. Some dogs have anemia, but some dog has anemia with thrombocytopenia problems. Okay, this one is explained the apicoplast. The function is here. So why we choose the drug to treat the apicoplast? If you use the quinolone drugs, you can suppress the DNA replication. So this is one choice to use the quinolone. And if you use the doxycycline or clindamycin, you treat the ribosomes. So and then let the amino acid cannot produce or translate. So they will such as the use treat the bacteria. So these drugs, all these drugs just treat another way. So we just today we just focus on the doxycycline and the clindamycin because we just use CDM to treatment. So I will introduce why we choose the clindamycin with doxycycline is here. And the babesiosis have a lot of Babesia have a lot of species, and we always know a big Babesia. We just call the Babesia canis. So canis have three subtypes. One is vogeli, the other was canis, the other is rossi. So in dogs we have these three ones and canis. And the other small one is we call the Babesia gibsoni or Babesia caroides. Okay, these two is the most ones. And in US we most have they have caroides, but in Taiwan we maybe just 10 years ago or 20 years ago we always think we have only have gibsoni, but recently I find in several cases with Babesia caroides in Taiwan, and I will show you the sequence of the test in Bioguard laboratory. They give us the answer. Okay, so the other species maybe will in every country. So if your country have another species, you may be ask for your laboratory to add it in the primer of this species. And the feline is not our topic today, but feline have felis, the canis species, and the county. And these three one is most common in the feline babesiosis. The human one is McCarthy and divergence, and these two is more common. This one is a case I send because we use the Q-mini PCR, but we test it's negative, but I use another PCR machine. I find the other machine is positive, so I let the laboratory to recheck the the sample for me, and we figure out the Taiwan have this sequence, just Babesia caridae, and this one is California forms. It's different from the gibsoni forms. Okay, but in blood smear we see the same. It's ring forms. Okay, so we continue to the clinical symptoms, and mostly the dog, in fact, babesiosis, we got the first one, we will see they got anemia problem. So we will see the dogs will lose appetite and the weakness and the pale oral membranes and conjunctivas. And in the acute phase, we can see they have a fever. But in chronic phase, we didn't see the fever. It's not the problems. And the other one is hemoglobin urine, this dark brown urine. It's just lots of dog has these problems, and more seriously will got the hemolysis anemia. Okay, but in the so we see a lot of paper or textbook will always say the dog got, in fact, the babesiosis will got icterus or jaundice. But I think if the dog is normal liver functions, the dogs will be not have jaundice or icterus. Because the liver function is okay, they can resolve lots of the hemolysis anemia problems. So in my experience, and I just treat over hundreds dogs, and I just see 1 or 2 dogs has this symptom. It's just icterus or jaundice, and that dog we just test do the blood test, so we find the liver function is not good. You must to know when the dog have a serious anemias, the dogs will have a cell infection blood supply, oxygen supply to the liver. So the liver will have no oxygen conditions. So without oxygen conditions, so they will let the liver cell easily to death. Also, so we must make sure the liver cell will not rupture or dead. The jaundice or icterus will not happen. And these have 2 Babesia forms, and we always know the large Babesia and the smaller Babesia. So this is a size difference. And then in the blood cell, we can see the different forms. One is pure form, the other one is a ring form, just like this one. This is Babesia canis. We can see like these ones, and this is babesiosis, Babesia gibsoni. It's a small one. This is a poor puppy dogs, and it just got lots of tick on the ears and the face, and just adapt for Americans in Taiwan. So you just bring the dog here. We see it's very pale and not yellow, only pale. So its urine is very bronze. So we just see the dog, even the puppy dogs, we always see is white dogs, not the yellow dogs. Okay, so I think when you suspect the dog got the Babesia infection, you should do the following things. The first one, you must do the complete blood cell counts, because you should make sure the dogs got regenerative anemia or non-regenerative anemia, because that's most babesiosis will cause regenerative anemia. But some dogs you will find they have a non-regenerative regenerative anemia. Why? Why some babesiosis dogs will have a non-regenerative anemia? Because the dogs is chronic infection, and the bone marrow will tired to respond for the EPO problem, the kidney problem. So the other one is the dog have another kidney disease, maybe will decrease this one. I just told you in formal PPT, they inside will say they will produce the antibody with the immune complex. Will, if the seeding on the kidney, they will cause the nephritis, so cause the kidney function will decrease, and maybe just slightly just affect the reproduction of a RBC. So maybe some dogs will cause the non-regenerative anemia, but most is a regenerative anemia. And the blood chemistry include the iron, because we should before we treatment, we should make sure the dogs is healthy, and the other organ is good for work. So we just give the make sure the liver and the kidney, everything is fine. And the CRP, C reaction protein, is good indicates. And because when you got serious infection, the CRP will getting higher. So this is a correlation of the series of babesiosis infections. So but it's negative correlation of PCV. So we can see the results in next Suzuki's papers. We can see that result there. And the blood smear, which we must do every times if you suspect the infect of the Babesia, because we can see the ring form or peel forms, and can make sure it's have a big one or a small one. But you must to carefully when you use the stand, will contaminate you will contaminate the dyes, and the lot of particle inside of the blood smear. You will misreading of a babesiosis. So be careful when you dye the use the dye to make the blood smears. And the other way, you can first choose the in few minutes can use the Bioguard 4BX. You can check the antibody is higher or not with the babesiosis infection or not. But this one only can test the antibody, so be careful for the positive and the negative meanings. And then finally, we just use a PCR to recheck, because if you cannot make sure the Babesia in the blood smear or the positive in the antibody test, you must do the PCR. So right now I have a PCR and the antibody test and the blood smear together to do. This is a Bioguard and the antibody test. So the best way to diagnose the babesiosis, the first one is we will choose the high quality microscope, and you can choose the Zeiss and the Leica or Olympics, and you must have a good experience for reading the blood smear, because if the lots of dye particle inside the blood smear, you will misreading. Sometimes the particle will in the on the red blood cells, you will reading just like the Babesia gibsoni. So please carefully to reading. And then if you use the Babesia gibsoni antibody test, you must choose the best time, because acute phase, maybe the antibody will not produce, you will have a false negative result. So positive or negative reading, you must know how to use these products. And the PCR test, I think you must choose a good and the standard quality laboratory, such as Bioguard laboratory. You can send the sample to that. If you have an in-house in-house machine, you must know you must be care of the procedure, because you should wear on the glove and the mask. The operator must to wear on the mask and the glove to avoid contamination the samples, because sometimes you will sneeze, or your hands, your cell just drop inside the primer, you will affect the result. Okay, so this is 4BX. You can choose. Okay, so the limit of the antibody test, the positive will that mean is a past infection or infection right now, and after the treatment, the antibody test always maybe still positive, and maybe you will find some false negative, is just immunofunction inefficiencies, maybe negatives. And if you use a steroid, they will negative results. So this one is very important. When you see the negative, if the two problem will cause that, or the acute phase. Acute phase will mean that the antibody it is not produced enough to test. So, and the other false positive, maybe you should know. Okay, this is a Q-mini, and right now I just use Q-mini to check the babesiosis. I think that is a very coincidence, and this result of the papers. I think the report is very good, because we can see the chart here, and the positive, they can show the CT values here. So, and everyone is just got infected, you can see the results here. And when the test maybe because the whole test only use 1 hour, so maybe that 30 minutes we can see the result is positive. We can do follow treatment as soon as possible. Okay, this the other one. So we have a big one, Babesia canis and the Babesia gibsoni, and this is negative results. It's just like this one. Okay, if you use the PCR, you must make sure you didn't use any antibiotics or anti-protozoal drugs. So this use PCR is very important to reading these lines. And then if you have give the antibiotics and give the anti-protozoal drugs, you will affect the results of the PCR. Maybe will cause the results become false negative. So they will cause them become negative, but they just still infect the dog. So when we check the PCR, I recommend you stop treatment for 1 week, and let the old drugs to expel to the bodies. So that's very important things. And how to prepare blood smear, I think everyone can do that. Yeah, and we're just reading the molar layer here. Okay, it's easy to separate the red blood cell, and then we can easily to read it here. And then we just use 100, and 400, and the thousands megainfections to check everywhere. So this one, everyone can know that. And the stain method, we can use the new stain, deep quake, or Jinsha stain. In Taiwan, we always use the new stain. It's very easy and quickly. This one is Ehrlichia. You can see here is Ehrlichia particles, and this is Babesia gibsonis. Okay, treat protocol. I will share with you. And the first one is AA treatment, advocaine and erythromycin, 2004. And the other one is a CDI. It's just published by Dr. Su, and that's a 2012. And the other one is Dr. Huang's. It's just 2010. It used doxycycline, enrofloxacin, and metronidazole. And the fourth is Suzuki ones. It's just use a CDM, clindamycin, and doxycycline with metronidazole. Okay, we found the AA treatment first. AA treatment is very easy. Just give the advocaine and the erythromycin. The first published these papers, we use the two kind combinations, and advocaine is once a day, 3 times a day, and the TID, and just mix with food, because this is oil. You must absorption by the fat, the oil. So you must recommend you use the advocaine. You just mix with the food. It's easy to absorption. So the dosage is 13.3 milligram per kilogram, and for 10 days. And the erythromycin is SID as once a day. It's just 10 milligram per kilograms for 10 days. But right now, if you use follow the paper, use 10 days, I think that is enough. So right now we have recommend if you use AA, because drought resistant problem. So we recommend you use AA treatment. You maybe extend to 21 days is better. And someone use AA treatment, use 14 days is not good, but right now just extend to 21 days. Maybe this is good choice. And advocaine have two forms. I recommend you use liquid forms, because liquid form is side effect. It no side effect. But use the combination forms. Use prochlorinials with things. This one tablets is not good, because they have lots of side effect. I treat AA once for dogs. So to the golden retriever, they have a severe, just like hair drops, gastrointestinal upset, and pancytopenias. So I didn't recommend use the tablet form. I recommend use the liquid form. It's better. So erythromycin is Pfizer, so this is easy to use. But you must know, if you use a treatment, they have a resistant problem. So right now, it's just published by the Dr. Su's papers. They told him the CYTB gene have associated with advocaine resistant. Okay, so this Dr. Su's treatment is a CDI. What is called a CDI treatment? CDI is clindamycin, and the diminazine, and the immunocups. So this treatment is have 28 days. The first day we injection 3.5 milligram per kilogram of diminazine, and then in first day. The second day we inject immunocups 6 milligram per kilogram in the other side. So you didn't not to inject the same leg. You must choose 2 legs. One is for the right left, the other for the right, and in different days. And the following, we just give the clindamycin 30 ml per kilogram BID for 28 days. But if you use this treatment, you will find the dog will have a side effect about the vomiting problem. So I think if you use a high dosage of clindamycin, the dog will feel uncomfortable and upset of a gastric stomach. So they will cause the dogs will decrease appetite, and then nausea, and it's not good. So the treatment it have this side effect. And the other one, the must to know how to stop the treatment. The PCV back to the middle of the normal range at least 1 week. So that means the PCV is return back to the normal range in the middle range and 1 week, and without the Babesia gibsoni image in the blood smear continuous 2 weeks. So this is stop times. Okay, this is a separate 2 groups. Just use one AA and the other one is CDI to compare with the in day 0, day 7, day 14, day 21, day 28. The change of the CBC and the blood smear, everything's here. So this the protocol of the insights. Okay, the other one is a DEM and the DDEM treatment protocol, and this is Dr. Wong's treatment published treatment. It's just use doxycycline in enrofloxacin, metronidazole, and with and without the terminus injection, and the dosage is here. It's give you the range, but it didn't give the accurate dosage. So just we didn't could not figure out the true dosage in this paper, and we didn't know how to stop the treatment protocol. And so just for the reference, if you want to use the treatment, you can follow your thinking. Okay, the Suzuki CDM treatment. This is the first time I published the treatment of CDM, and when I do the CDM treatment is 2002, and in that time we find the treatment in the books, and we didn't find the CDM combination treatment. So in that time I find my treatment my experience in treatment is good. And then every dog is cured, and every goat is go back to healthy, and recheck the PCR, everything is negative. So I didn't know why always say the Babesia is always in the body, could not cures. So this is it's very let me confused. So and so we just have this topic when I get the master's degree. So I just do the test and step the 2 groups, and I will introduce my experiment. Okay, and the Suzuki CDM until the first published only 4 dogs. So the 4 dogs and the non good separate the 2 groups. It's just 2 groups, 3. The other one is 1. So it's just first time to post the clindamycin dosage, just 25 milligram per kilogram, and the doxycycline is 5 milligram per kilogram, and the metronidazole is 15 milligram per kilogram, and twice a day. This is the first time they publish this treatment. But this paper, the key point is CRP level is negative correlation of PCV levels. So and the positive with the series of the positive correlation of the infection levels. So that is my experiment. But this paper only this results here. So CRP maybe could be a prognostic index of a babesiosis treatment. So this paper give this one. So and the other one, this paper didn't give us the accurate treatment period, because just over the 150 days treatment is still there. So why? Because they do the splenectomy. So if you remove the spleen, you will let the babesiosis treatment is become difficult and not curable. So you must to know right now we didn't recommend any dog to do the splenectomy to treat. If you want to treat the babesiosis, do not do the surgery. Okay. Okay. This they have 4 dogs, and every dog just do the splenectomy. So just use a artificial injection the babesiosis, not a neutral inoculations. So you must to know. It's just artificial to do that. So and after the treatment and not good, and after 126 days, just to do the same treatment. Okay, here. So why should me to choose the CDM? Because 2012 here we can see the CDM have this treatment just published by Suzuki is here. Okay. So why choose this drug? Because this is the 4th edition. I just to the 2 editions, and in that time the 2nd editions the books just show us we just choose that time I have diaminoxine here, and I can choose the clindamycin, doxycycline, and the metronidazole. So why should I choose the 10 milligram per kilogram? Because lots of people didn't show us the co-infection problem. I assure you, I will tell you, the pathogen transmit times, the Ehrlichia were earlier than Babesia. So how could you know the tick only transmit Babesia without Ehrlichia? So sometimes you use AA treatments, CDI treatments, you will find one thing why you're not good enough for the treatment, because maybe some co-infection problem. So why I choose 10 milligram per kilogram of the doxycycline? Because you can treat such as Ehrlichia, such as Anaplasma, such as Ehrlichia. So this is very important. You choose 10 milligrams. So you use 5 milligrams. I didn't think that is good choice. So 10 milligrams is better than 5 milligrams. So this one, the clindamycin, we choose the 15, just the middle of this size. So 15 milligram per kilogram. So metronidazole, we choose 25 milligram per kilogram twice a day. Okay, this is my treatment here. My paper, just my thesis, we do that. We just separate 2 groups. One is for the DCDM, the other for the CDM. CDM only use the history here, and just use a clindamycin 50 milligram per kilogram BID. If you use this dosage, still will cause a little bit vomiting symptom of the dogs, but it's better than use the 30 milligram per kilogram. If you use a 30 milligram per kilogram, it will cause a serious vomiting problems. Okay. So this dosage is here, and the injection size is twice in 12 hours intervals. Okay, this is my experiment, and we separate 2 groups. One is CDM, one is DCDM. It's the same, such as the Diagnostic papers, protocols. So this protocol we just figure out the day 0, 7, 14, 21, and the 35, and the 42. Why could I every week to check? Because every week to check, our patients will spend lots of money. So we just choose right now we just use a 2 weeks interval to treat, and I will show you next time. And this is the results for the treatment. And then the 2 groups, if you use the CDM and the DCDM, you can see this is we have see the significant difference in first week. They have a significant difference. When the use the DCDM, it's easy and quickly to recover of the HCT, but you use the CDM, is slowly recover. But it's the same way after 2 weeks later, the 2 groups no differences, and the 3 weeks or 4 weeks later, everything is almost the same. So the 2 groups, if you use within the injection they will got a quickly recovery effect. It's the same in the HGB check. The CDM group is slowly recovered, but the second weeks, the two groups without any differences. But the platelets, they didn't have any significant differences. Okay, so this is a 16 dogs I give, so we can check the liver functions, and the liver function we can see have one or two dogs, they have if they use the CDM, they can getting higher the ALKP or ALT. So this is a result. It's just not just give me a hint. Just when you use the drugs, you must to monitor the liver function and be care of the liver function. So here is the same. These dogs and these dogs and they have the same problems. Some dogs is before you treatment is higher, but if they use the CDM, they were getting higher. So you must maybe you should combine with some liver drugs to give the dogs, such as slimarines or ursodeols, to make sure the liver and the cell is getting better. Okay, and then the comparison of the treatment protocols, and when the paper will show you the cure rate of AA treatment right now is 52.9%, and the relapse rate is 41.2%. But the relapse rates, they didn't say reinfect or only relapses. So because the paper didn't show after the treatment, they will recheck the PCR again. Okay, so this result is from the Dr. Su's papers. Okay, so CDI, the cure rate is 84%. And the DEM is 83.3, and the DDEM is 85.47. Suzuki is 75. But my treatment, 100%. But 100% is not good to explain. But right now I made one or two dogs. If you use single one treatment, single antibody treatment, if you use the dog have received the clindamycin for 4 weeks, 6 weeks, or 2 months, 3 months, and only use one drugs, you just come to use just switch it to the CDM, you will weakness the effect of the treatment of CDM. Yeah, because maybe the Babesia will have a drug resistance. So you must to know that. Okay, if you want to resolve some minor or moderate anemia problem, you can use DPO. DPO is better to choose, but it's better than EPO alpha or beta. So DPO is good choice for the once a week. It's a good for check, because chronic infection will weakness the weaken the reactive of the bone marrow for the kidney problem. So just you can see the paper here will explain a lot of things. So give you overview the summations here. AA treatment. If you choose AA treatment, you must be careful of the drugs resistance. The treatment will inhibit the most Babesia, but maybe will relapse, and the PCR is still positive after stop AA treatment. And the disadvantage of disease treatment, the clindamycin high dose will easy to cause vomiting and the nausea and the gastrointestinal upset, and the great appetite and the spirit. So you just give the injection will cause anemia, immediate immune-mediated hemolysis anemia problems. So you must to be careful, because in my research, and the two groups, and when I injection the 5 6 that group have 7 dogs, and 1 dog will die after inject the diaminosin. So diaminosin will cause quickly cause the red blood cell quickly rupture, and cause increase the risk of the IMHA. So you must to make sure these problems. Okay, the effect of DEM are the same conclusion of the paper. We didn't know, because I haven't any experience of a DEM treatment. And after inject diaminosin, you must to know one thing, and the patient's red blood cell will easy to rupture and introduce immune-mediated hemolytic anemias. Okay, so this problem you must to know that, and then must to announce your patient's owner. So if you didn't tell him that, and after injection, the doctor will die in 1 or 2 days, because very soon the red blood cell and the PCV will drop very quickly. So be careful, use the diaminosin injection. So mild to moderate anemia problem, you just consider to use DBO. But severe anemia patient must just consider to do the blood transfusion. Blood transfusion will not my first choice when the dogs got the not severe anemia, because I just told you, when the Babesia infection will go into the humoral immunity pathway. So you just go that way, they just produce lots of antibody. You just put in the foreign cells from another dog, so they will increase the risk of IMHA. So I didn't recommend. If the dog is okay, it's good spirit, can go around, you just use a CDM first, and just let the recover slowly is safety. But use an injection or just use a blood transfusion maybe cause a serious thing. Also, that's right. Okay, if you use a DCDM treatment, red blood cells, PCV, HGB will recover first in first week, and then but easy to induce IMHA because it inject the diaminosin. So right now I just use a CDM treatment. So how long to use the drugs, and I will explain after that. Okay. So right now we just use the field to examination the AA treatment, CDI treatment, and the DEM treatment, CDM treatment. The drugs available is easy in clindamycin, doxycycline, and metronidazole, because this is we common use antibiotics, easy to get it. But the atovaquone is difficult to get in some country, so such as Taiwan. Taiwan is very difficult to have this drug. So, and the cost is very expensive. So we call the drugs is golden water. So just 1 cc is cost maybe 1,000 or 2,000 NT dollars. So it's very expensive. So, and the treat times and everything's, I think CDM is good to choose to treatment after my experience. Okay. The reason of the failure treatments is just you must to know the drug resistance is the first problems, and then the second time you didn't have a good diagnosis, you just misdiagnosis, just because you see the anemia, always you will see the dog got the Babesia first, but maybe some dogs got the tumor problems, so such as golden retriever. If the dogs have anemia, you would think the problem first choice is maybe it's hemangiosarcoma. It's not babesiosis. So if after you do the PCR check, everything is positive, and then just do the treatment, and that will have a good response. And then you didn't have a good response, they will have a drug resistant problem. Okay. Okay. The other is just a poor compliance of a pet owner or dogs. Sometimes because you just feeding the drugs by mouth, some dogs will refuse to take the medicine, and they just spit it out. So maybe will cause the drugs intestine is not good, just feed, and then the owner could not easily to feed the oral medicine. So you must know that. The other one is drugs interactions. So if you use antibiotics, you must know, you must prevent the dog drink milk, and uses some drugs such as sucralfate, the stomach protecting drugs to let the drugs absorption, stop the drugs absorption. So this problem, the interactions, or use some drug to interact the absorption of the antibiotics. So you must to know that. And after treatment, and the dogs without using the no use the prevention drugs will cause reinfections. So if your dogs at the treat time or after treatment didn't use the frontline or the tick the drops prevention or oral medicine to prevention, they will get reinfect again, because the dog got the infection from their surrounding. They just live there. So that tick have the pathogen. Okay. So the other things we just know, reinfection or relapse. Okay. And the next one just a refractory infection. I just got 2 cases. It's just a refractory infection. Use 2 times CDM, two treatment times of the CDM. They will recover. Okay. So conclusion. First, make sure Babesiosis or other reason cause the anemia. So you can use antibiotics and the plasma and the PCR. The oral medicine uses CDM for 6 weeks. You check CBC plus chemistry and the CRP plus meal and 1 or 2 weeks. And when you use the CDM treatment, then according to the result, adjust the dosage of oral medicine. After finish the 6th treatment, and then stop all things for 1 week, just do the full blood profile and the PCR. And then this is a flow chart for everyone, and you can easy to know how to use the CDM treatment and the recheck times. So right now, I just recheck time will have we will not use this sequence. We just use 2 weeks, 4 weeks, and 7 weeks. Just reduce the recheck time, and because all the patient the pet owner will consider you have a money concerns, so have a cost concerns, so they will spend less money to recheck. So if your pet owner will not consider the money is not the first concern, you can just every week to check. It's fine, no problem. So just make sure everything is just go through and if the liver index is getting higher, maybe just added more the drugs to prevention the liver index just going down. Okay. So today we just finish the lectures. Thank you. Okay. Stop. Okay. So everyone. So I see the question. Okay. If we use the steroid, but the liver affects what another activate an immune for the immune system. This question I want if use the when you use the steroid, we will not use steroid for the common treatment with babesiosis. If the dogs got immune mediated hemolysis anemia, you must use the steroid. But after you use the steroid, you will extend the treatment times. Maybe we'll extend 8 weeks or 12 weeks. This is my experience. So I will not use the steroid to treat the immune problems in the first time. So the small we will make the small problem. If you didn't to stimulate, give another blood, such as blood transfusions, just use the diaminosin injections. I think the autoimmune problem will not happen. Seldom happen. And I just made one case. So I just use a CDM treatment, but just a little bit, maybe just like I use antihistamine, just stop it. If you find 1 day just a drop more than 3% or 5%, 3 to 5% PCV, you must consider to use steroids. Yeah, it's too quickly. So I think in the first week, and when you use a CDM, you just only drops maybe 3%. Yeah. So in 1 day, if you drop to more than 5%, it's very serious. Maybe you must consider they have a IMHA problem. Okay. And 不管猫胶虫、PCR、全胶虫不分型。And some people will ask us some question about feline babesiosis treatment. And the feline babesiosis treatment, you must make sure you really got the infection of babesiosis, because the tick on the body, and when the tick on the cat's body is very few to see. Almost the cat in the wild is have a chance to get this disease. In the domestic cats or just in-house cats, I didn't think the cat will get infection. And if you want to treat the feline babesiosis, use a CDM. It's okay or not? I didn't know, because I didn't have the experience. But I can tell you, the Babesia canis or Babesia gibsoni, not only small one but also big one, receive CDM treatment is okay, no problems. Yeah, it's a well cured. Okay. And the SAA, because I the same, I didn't have an experience to use SAA to check the feline babesiosis. So you can try it. Yeah, maybe you can try it and tell me it's okay or not. Okay. And the other one, have another question. I think no question. No question. Okay, I see. PCR 阳性，后续怎么治疗调整之类。Okay, if you use CDM for 6 weeks and after stop the treatment and PCR positive, you must to check 2 things. One thing is the dose compliance is good or not, and just the oral message feeding inside or not, because in my protocol, if no drugs interactions, you use 6 weeks, you must complete the treatment. If you got everything is okay and still positive, you can try another 6-week treatment. The 2 rounds treatment after that, after the 2 round treatment, I think 100% will cure, will not occur. If it's not occur, it's got something wrong. So in my experience, have one dog have received the AA treatment and do the splenectomies. So the dogs are still positive. And I try first 6-week CDM treatment. After that, the dogs still positive. And I'll try the second times, 6-week CDM treatment. After that, the PCR is negative. So I have 1 or 2 dogs have refractory infections. So they will you will make that. I didn't think you should adjust the dosage. Just continue again. One treatment protocol is enough. Okay. Okay, the question. Hello again, EDM. 如果停给if you stop give the Immunological and Diagnostic, the IMHL will got improve. No, I will tell you, if you induce the immune mediated hemolysis anemia, you must treat it. You will not stop. You stop the injection will not get any improvement. You must treat it. So you got a big problem because this is very, very terrible things. The dog, if you didn't use any drug to stop the immune problem, the dog will die in 1 or 2 days. So it's very, very soon. So at that time, you must use the high dose prednisolone with maybe IVIG to stop the IMHL problem. In my experience, when got the dogs become seriously IMHL, you just use maybe 1 to 2 milligram per kilogram prednisolone in first time or 2 in 3 days, and maybe give the blood transfusions and can stop everything. So it's very terrible, but mostly the dogs become serious and dies. The chance of become dead or dies is higher. Okay. Okay, can I use CRP for cat? No, if you use CRP in cat cannot use a CRP to monitor, because CRP only for dogs is a correlation of is a positive correlation of infection. CRP is not good choice, so just choose SAA. But right now, I didn't know have a commercial SAAs good injector. I know the VCheck have a SAA, but I right now I just try to use it, and I didn't have any common use SAA in VCheck, because right now I just try. Okay. And I think another problems. I 还有问题吗？ Tick-borne transmit in case of Babesia. Some question is just let me explain the blood transfusion in case of Babesia from health to another dogs. Blood transfusion to another dog is very easy, because the dogs have Babesiosis, the red blood cell contain the Babesia inside. So when you do the blood transfusion, the blood into the another dogs will cause the other dogs blood will got infected. This is very easy to understand. So the transmit not only the tick bite, the other one is dog bite, because if the dog have a biting and have a trauma and the blood transmit contaminant, they will cause the blood to another dog, that will cause infection. So this is two ways, and the other ways I told you, just biting the tick, the oral membrane have a trauma on oral membrane, that they will go into the blood. So, but it just swallow it or not anything, and the parasite could not transmit into the intestine cells, because when you go into the stomach, the stomach acid will kill the egg of the tick. So only one way, just when by the tick, and the tick just like a human, we just do that, just to press the tick, will spread everything out, and then the dogs has a trauma on the oral membrane, they will got infected. Okay. And the other question is, Babesia in cat often found in neutral or in dogs? Okay, and only I just told that the cat only in the wild cat maybe got the tick bite easily, because in-house dogs, in-house cats will not find that. Okay, but so the other things, if you the other things is the tick has the pathogen or not. If the tick without a pathogen, you find the tick on the body, they will not transmit the disease to the cat or dogs. So I think maybe you can figure out a paper in your country. Your tick species have this or have this pathogen in your country or not. So so I just figure out recently, the Babesia canine, because lots of people, lots of paper in our country, we always say we just only have a Babesia gibsoni, we didn't have a Babesia canine. So you must to recheck your country's paper. Maybe they will tell you the pathogen or not. Okay. Okay, the other one, you mentioned the PCR must be paired with first from the PCR with the same joint. Yes, and the question is, the PCR must be paired to administration the drugs. So what is the influence of the PCR result if a dog take a medicine in advance? And because it just told you you just take the medicine, you give the medicine first and just check the PCR, you will find maybe we will have a false negative, because someone will give the drug first and just take the blood to do the PCR, or you not stop the drugs, you just stop the drug, just do the blood test in that time. So sometimes you will feel, especially just finish the treatment, if you didn't stop for 1 week, and then just when you finish the drugs and take the blood, a lot of times the negative is not really negative, maybe it's a false negative. Okay. And the other question is, the feline Babesia is caused by the tick bites. Yes, the feline feline babesiosis is the same. It's just a tick-borne or the cat bite. Because the cat has the pathogen and the cat bites, they maybe will have the same transmit weight. Okay, so not only tick bite, maybe will tick bite. Okay, if you use a parasite for the tick as a prevention method, I think use the right now we have a commercial drugs. It's easy to prevention ticks, and that is very effective. So I didn't think use a parasite to use for tick to as a prevention method is a good way, because I think right now just fix the dose to prevent is enough. Okay. Okay, I think all question I think is finished. So have anyone's?
Yeah, many thanks to Dr. Wong for
Okay.
his outstanding presentation. And we hope to see you again in our next webinar. And thank you and good night.